My next presenter is Sumaya Maqsood from LUMHS, and she is going to present her research on breaking out in PCOS, a clinical insight into facial acne.
Bismillahirrahmanirrahim. Assalamu alaikum and good morning everyone. I am Sumaya Maqsood from LUMHS Jamshoro, and I am pleased to present to you all about the topic breaking out in PCOS, a clinical insight into facial acne. I will start my presentation with the background of the study. A polycystic ovarian syndrome is one of the most common endocrine disorder affecting commonly the women of reproductive age. It is characterized by the menstrual irregularity and hyperandrogenism. The rationale behind this study was that acne is one of the most common concern among these PCOS patients. However, the limited data was available on its frequency and severity. Moving on to the objective. The aim of this study was to determine the frequency and clinical characteristics of the facial acne in the patient diagnosed with PCOS. To achieve this, a cross-sectional study was conducted at LUMHS Jamshoro from March to April 2025. Around 50 female patients were participated in this study aged 18 to 35 years old. The patients that were participated included the female patient diagnosed with PCOS according to the Rotterdam criteria and were also diagnosed with the facial acne. Multiple data was collected from these female participants, including the duration and severity of acne, menstrual irregularity, hyperandrogenism, and also the BMI was calculated from these participants. To assess the acne, the standardized grading scale was used. This research led us to the multiple observations, starting with the facial acne severity. Around 76% of the population were reported with moderate to severe acne, and remaining 24% were reported with the mild acne. From overall population, 10% of the female participants reported with the nodulistic lesions, strongly associated with the higher BMI. Other than the severity of the acne, other clinical features were also observed in the PCOS patient, including the irregular menstrual cycle, hyperandrogenism, obesity, and psychological stress. As mentioned in this bar chart, the higher number of the population were reported with irregular menstrual cycle, and second most clinical feature were observed of hyperandrogenism. The hyperandrogenism include the sign of hirsutism, seborrhea, or androgenic alopecia. Lastly, the obesity and psychological distress was seen in 60% of the population. Majority of these obese patients were reported with a moderate to severe acne. Moving on to the discussion. This finding highlights three main important points. Firstly, the obesity or the patient with a higher BMI showed the higher acne severity, likely due to increased androgenic production and increased androgenic activity and sebum production, suggesting that the lifestyle modification and weight management can improve these patients' outcome. Secondly, the menstrual irregularity and signs of hyperandrogenism confirms that the PCOS patient have the systematic hormonal imbalance. Lastly, the psychological distress has a significant impact on the patient's life among these PCOS patients and making their symptoms more worse. These all three findings were also seen in other articles as mentioned in the slide. However, one of the article reported that an Iranian woman diagnosed with the PCOS shows no any significant relationship with the psychological stress, suggesting that the impact may differ across the age group. In conclusion, I would like to highlight that our study mentioned the facial acne is one of the most significant and common dermatological manifestation among the PCOS patient, often associated with obesity and hyperandrogenism. According to this research study, our recommendation is that an early diagnosis and integrated management addressing endocrinologists, dermatologists, and psychologists are essential to improve the patient's outcome. I will end my presentation by addressing the limitation and future directions of this research. Limitations included that the study was on small sample size and it was a single center study. Lastly, the psychological stress was self-reported by the patient, experiencing the symptoms like anxiety, self-esteem, and social withdrawal. For future direction, I will say that the large sample size and the multi-center study should be calculated in order to journalize these results, and a proper assessment tool should be used to capture the psychological impact in these patients. Thank you everyone for your attention. I will be delighted to
This is
take
a very good presentation, and I think we will take the question answer session at the end of this session. So अगर किसी को कोई questions हैं तो kindly they should note down. So we will take the question answer session at the end. Thank you very much, Bete. Thank you very much.
Thank you.
Thank you very much, Dr. Sumaya, for this commendable effort.